event like this. And what came to me is that pharmacists were lifelong learners. Am I correct? The day we stop learning, we start dying. So I won't take your time. It's a very simple topic, which some of you will actually do justice to it more than myself. I really recognize the wonderful men and women in this audience, and I don't want to make a mistake. Just know that I recognize you. The past chairman, the current chairman, our chairmen that we have invited, that have donated money to us, our traditional ruler that has left. I recognize all of you, and I'm happy to be in the midst of my people this evening. I gave a keynote address on last week Monday to Nigerian Association of Pharmacists in Academia. That's my own jurisdiction, right? At Ife. And he was talking about pharmacy education, and I told them that I was there to scatter their heads, to disrupt things. Are you with me? I don't like status quo. I like change. Hello. I just love change. I love to do things differently. And that's what makes life interesting, right? So if we don't do things differently, our profession will be extinct. Are you getting me? So we must find ways of doing things differently. When I took a course in industrial pharmacy, I said, how I wish we were taught like this in school. If we were taught like that, that was in Tanzania, we have so many production pharmacists that would have turned the situation around. Are you following me? So many times what we learn in the university is so different from what we practice. Are you a witness? Yes. So medicines can kill. One thing we know is that medicines are poisons, right? We are going to eat food now. Medicine is not food. And so it can kill, and it has killed many people. Both big, poor, rich, name it. Next slide. And then a prominent professor, I know this one, very prominent professor. And he was coughing and he kept taking cough syrup. You will not see cough syrup in my house. Hardly. You can't see cough syrup in my house. Because I want to know what is causing the cough, right? And then we treat it. And this great man started taking cough syrup. By the time, he didn't know he had pneumonia. And by the time he got to the hospital, he died. Hello. You know, so I know that case very well. And I taught a student who practically went blind because she reacted to sulfur drug. Are you with me? And I do know in my family we react to sulfur drug. I react to my son. I almost lost my son. And you know it's genetic. So that's what took me to pharmacogenetics. You know, not all doses don't fit all. Do you understand? One man's meat is another man's what? Poison. We begin to notice that. We begin to take record. So don't believe them, they tell you Septrin is fake. It's not fake. People just react to it. Some people react to it because it's a sulfur drug. And we need to recognize it as pharmacists. And case 4 too is a young man, is always on his computer, designing animations and abusing paracetamol. Are you following me? Very young boy, abusing paracetamol. Started having complicated condition. Next one. Antibiotics, you know, so that we can have them available to us. So we have the national essential medicines list, and there is a list which we should be familiar with. But we need access to it. And it should be safe, it should be effective, it should be affordable, it should be quality. And we have to re-emphasize that. Next one. I like this puzzle. You know, access to medicines. It should be rational, should be sustainable, affordable, reliable. Very important. As a pharmacist, at what level are you playing that role? Very important. Next one. Well, I have dealt a lot with the definitions. Next one. Looking at this is very important. Very soon, I pray it will not happen. They've been predicting it. That it looks like what's going to wipe the world out is antimicrobial drug resistance. That's the biological weapon that they said may wipe the world out. And we should not play with it. This resistance is due to misuse. Even we pharmacists, how many of us, once somebody is having diarrhea, you take flagyl? Isn't it? Yes. Even though some of us here, you will take flagyl, and your flagyl, you're supposed to take flagyl 3 times daily for how many days minimum? For 5 days. How many people complete it? How many of your patients complete it? And so many people are carrying cysts. So under that, you have misuse, abuse, and overuse. Antimicrobial resistance. I'm a researcher, and I can tell you that it's becoming difficult to discover new antimicrobial drugs. It has become a global problem, and people are dying because of it. Next one. These are action plans, and this is the situation in Nigeria. In Nigeria, anyone goes to the patent medicine store, people don't even know the difference. On a street, you can have 10 patent medicine store and probably 1 pharmacy, and they don't know the difference. So they need to know the difference. By the time you approach your practice with public health focus, they will know the difference. Now, advertisements. TikTok. People are using TikTok to advertise medicines. Hello? They are using it to advertise medicines, and it's becoming worrisome, including prescription medicines. Next one. Look at what happened in Spain. What did the pharmacists do? I know we're eating. What did they do? They complained. They rose up. Hello? Spanish pharmacists did what? They rose up. And I pray we rise up against marketing our drugs through social media. How lax social media policies help fuel prescription drug boom? So we need to rise up. We need to speak. We need to speak. Now, look at the Nigerian situation, open drug markets, economic hubs, or express way to where? To early grave. Do we want our people to go to early grave? So I want us to be passionate. I was talking to somebody recently, even I think it was last night, about a particular person who is a drug addict. That person has been a drug addict for over 30 years. Hello? If not 40 years. And you know, she was just pitying him. And I saw, he's a patient. The drug abusers are what? Patients. So let's pity them. They are patients. Yeah. So urgent response is needed. And so we need to look at our roles in curbing drug misuse and drug what? Abuse of medicines. So how do we control it? It's not only pharmacists, starting from family. My heart bled. I led the committee for PSN that set up a committee for cannabis. Whether we should whether cannabis should be approved for use or not. PSN set up that committee and I chaired it. It was a tough one. It was a tough job because 1 or 2 persons in that committee, they said we should promote it. It should be allowed.
No.
You know, we should be allowed to plant it and all of that.
No.
And I know that even till today, we are still having problems with cannabis. So family, back to that slide. Family, government at all levels, religious organizations, and then we healthcare practitioners, and I would say pharmacists. All of us should be involved. Like I said, it affects us. I'm a Vice-Chancellor and I can tell you how some parents will come and they'll be rolling on the ground about their children. And unfortunately, we do not have a rehabilitation place for them. We send them back home. Let their parents find a way of rehabilitating them. And I want to say, to the glory of God, Chrisland University, I'm told, somebody did a surveillance, is one of the safest places to be when it comes to drug use. Because we partner with NDLEA. NDLEA is doing a very fantastic job for us. And the students know. Hello. So many times when you are getting transfer students from certain countries, we know we flag them. Or from certain institutions, we flag. Maybe you do a test, they are positive. Next one. So, the pharmacists will have a very great role, like I said, more of public health. Next one. What's obtainable in pharmacy? You have to look at adherence to medication if you want to prevent self-medication. You have to look at the fact that you should be you should be dispensing or stocking approved medicines, and enforcement of our laws by the government, or working with government for enforcement. And number 1 is so important to us, patient counseling. And do we have time for it? When I gave that lecture last week, we stumbled into a paper where they looked at community pharmacies, and through focus group discussion or interviews, some of them said, look, all I do from morning till night is sell. I have no time to talk to anybody about how to use the drugs. Are you following me? So we need to move away from that. He said, from morning to night, I'm just selling. I think we should move away from just selling to both selling and providing what? Counseling. Please. Very important. Next one. Training and training. You know, we are 7-star learners. We should be training ourselves on how to curb this misuse. And then we should rise up against advertisements on social media. That we need to stand up as a force and rise up against it. Okay? So, we should become more patient-oriented. I know our profession is both product and patient, so we've been selling that information. And the only way you can do it is by training yourself, changing your mindset. I am here to make sure that my patients or my clients get good health, get quality health, quality counseling. Everything about us should be what? Quality. Next one. I've talked about the 7-star pharmacists. When you look at that, we should be compassionate. Make a decision about what you want to do. Be a communicator. Be a lifelong learner. Be a good manager. Possess leadership skills and possess the ability to teach. If you have that at the back of your mind, you can use these tools to address DA and DM. Yes. The OTC medicines, we found out now that they can be abused. All the cough syrups, thank God for how everybody rose up. At least that bit has reduced. Am I correct? But when you shut one door, other doors we do what?
We open.
We open. Other doors open. So we should provide insight into all aspects of these OTC medicines that people misuse and abuse. Even the Valium, I know we do record it, but we know that people still abuse it or misuse it. And then strict compliance to what we have been taught to do. I'm going somewhere. Next one, I'm just going somewhere. Community pharmacists, we can become public health what? Pharmacists. Back there, that's where we really dwell, most of us. That awareness, have all the pictures in your pharmacy, let them see the menace. Do you understand? Follow up, devise innovations. Let there be a collaborative approach. There is this Victory Drugs, Mrs. Lawal. I just love the way she practices her community pharmacy. You know, she works with nurses, with doctors to provide health care for patients. She collaborates with them. And it's very good. I mean, in the US, you see people these days, this is the doctor's clinic and this is the pharmacy. Are you following me? So the two of them working hand in hand. We should begin to see more of that. Hello? And then for research, those of us into research, everybody can do research. We should begin to look at how to curb innovative ways to do that. And people say that's what saved us during COVID. Because you could go anywhere and buy whatever. If they say it's chloroquine, you can buy it, correct? If they say it's Bentin, or what's the other one? Azithromycin, you can go and buy it. I remember one of my cousins, and two of my cousins in the US, one in US, one in UK, they couldn't get chloroquine. You know, it had to be smuggled. Are you following me? And I know some of them might have died because of that. You know, maybe God just used that one to save us. How be it? If we begin to count how many people have died of misuse, it will be too much. So drug abuse, drug misuse, when you check the dictionary, sometimes they are mixed together. Do you understand? But the simple way of saying it is that drug abuse, most times, you are talking about illicit medicines. You want to go, the people that want to be high, and then this young one. But drug misuse could be, I've not slept, let me take Valium. Are you following? Or I'm coughing, let me take antibiotics, things like that. That's drug misuse. So the difference between a person who misuses drugs and a person who abuses drugs is their intent. The other one will treat the ailment, while the other one will be used to elicit certain feelings. Next slide. So these are the differences. So you just know it in your mind. I know you don't need it, but for non-pharmacists here, they need to understand it. Most of the time, the drug abuse affects the central nervous system. And we know we are dealing with that a lot in our country. You cannot wish it away. And that's what is fueling crime today. If you see you won't take part, you won't do something. There's no way people can just kill if they are not under an influence. There's no way people can just kidnap if they are not under an influence. And they're all around us. I mean, I live in the Media Village. Just from my campus to Media Village should be 5 minutes. You'll be bleeding the blood of Jesus because of the trailers. And there's no way they can drive like that except they are under what? An influence. So don't say, I'm not involved, I'm not part. It affects us. All round, people will not commit crime without being under what? An influence. If you go to the eastern part of the country, all those days they are abusing amphetamine. Are you following? So we cannot say it has become epidemic, and we cannot shut our eyes and say it doesn't concern us. It concerns us. And now this is politics. They're going to put a lot of money in their hands, and a lot of terrible things may be happening. All right. Next slide. Close to it is self-medication. Self-medication can be, there's a good self-medication, very tiny bit of it, but most of the time self-medication is under drug misuse, so I won't go that route. You know, you just get medicines without prescription, and sometimes people don't have patients go and queue in the hospital. They just want it what? Quick. They can't even queue in the pharmacy. They just go somewhere and buy it what? Quick. The wheelbarrow, anywhere they find it. So this is just a study to show you how people self-medicate and misuse drugs. It's a study. Next one. These are the elements of misuse. Overprescribing, self-medication, fake medicines, wrong drugs, wrong doses, overuse. Some people, if they don't take injection, they don't believe they've been treated. Meanwhile, we do have the rational drug use, which everything must be appropriate. And you see there, appropriate drugs by the pharmacist, appropriate dispensing, and so on. Next one. So we have the irrational, which is also part of, so they have these different names: abuse, misuse, abuse, self-medication, irrational. They're all part of it. This is, we're all used to people that do ACAPO, right? Put this, put one, put that, put that. This will kill. And when you look at it, they have NSAIDs, they're anti-inflammatory. Some of them end up with ulcer, and so on and so forth. The opioid crisis. This is one study that was done recently, and the result is by United Nations. And over 14% of Nigerians abuse drugs, especially tramadol. It's a film. You can watch it you can Google it and watch it, and you will be amazed. You will be amazed. People sweeping the streets. These women sweeping the streets, Okada riders, people that are pushed, doing any hard labor, they are abusing medicines. They are abusing medicines wherever you see them. People that are carry bags of rice on their back. It's not normal. They're all abusing medicines, and that's why every little provocation in this country, people are fighting, right? Every little provocation they are fighting. They're under an influence. Next one. So it affects us. I've said it. Next one. So pharmacists as key stakeholders. I'm going to look at public health aspects of this, because it's a public health issue. We should take it up as a public health issue to help our nation, to help our people. And so as pharmacists, we should begin to play the role of public health pharmacists. Are you getting it? That's my message. That's actually my message this evening. Let us look at how we can play that role of being public health what? Pharmacists.